Greetings. Let us talk about the role of Lugol's iodine in GI endoscopy. These are my acknowledgements. And the learning objectives today: one, to learn about the purpose of Lugol's iodine spray, and number two, and how to use it. So, when you're preparing for Lugol's iodine chromoendoscopy, this is something that we do when we want to screen patients for squamous cell cancer of the esophagus. So when you set up the table, you need Lugol's iodine solution, and literature suggests to use about 1.2% solution. And if you have a concentrated solution, you need to take a cup and some syringes with saline and dilute it to 1.2%. And make sure you have some gauze, because Lugol's iodine can stain things around. And once you have the solution ready, you take a spray catheter and attach a syringe filled with 1.2% Lugol's iodine solution to the spray catheter. So once you have it ready, the endoscopist goes ahead and does the procedure. And once the endoscope is close to the GE junction, he will ask you to give the catheter. Make sure that you don't spill Lugol's iodine on any of your working area. Once the catheter comes out, you gently start spraying the Lugol's iodine as the endoscopist tries to pull the catheter back along with the scope. And as the Lugol's iodine reacts with the squamous epithelium, it turns brown. So the squamous epithelium, unlike the columnar epithelium, is loaded with glycogen, and glycogen is taken up by the Lugol's iodine and changes its color. Normal squamous mucosa stains uniformly with a brown staining because of the presence of glycogen. Whenever the squamous mucosa becomes abnormal, it loses glycogen, and there will be unstained areas. So when the glycogen is negative in cancer or in inflammation, then it doesn't take up the stain, and it becomes negative for brown staining. So Lugol's iodine chromoendoscopy, that is by spraying the dye, you're changing the color of the squamous epithelium, and then whether it retains the color or it has areas that has no color, the brown color. It is useful for diagnosis of squamous cell cancer of the esophagus, and it's also useful when you suspect acid reflux but you don't see erosions, otherwise known as non-erosive esophageal reflux disease, and it can be helpful in those conditions as well. Squamous cell cancer is one of the commonest cancers of the esophagus across the world, and in areas where it is common, endoscopists use Lugol's iodine staining to screen for squamous cell cancer, and when they plan to resect it, they also use it to define the boundaries of the cancer. So let me summarize. We have learned about Lugol's iodine chromoendoscopy. It's used for screening of squamous cell cancer of the esophagus. It's also used to diagnose non-erosive gastroesophageal reflux disease. Otherwise, sometimes you may hear people saying NERD, N-E-R-D, non-erosive reflux disease. One must keep in mind what are the potential risks of Lugol's iodine. Lugol's iodine solution is an irritant, so patients may complain of heartburn after the procedure. It is a good idea to wash off the dye after the procedure and dilute it. Or you could use a spray of N-acetylcysteine after the iodine spray is done, once the exam is over, to cut down that irritation. It should be avoided in patients who are allergic to iodine, and you should also avoid in patients who have thyroid disease. In some patients, it could precipitate thyrotoxicosis. So you need to keep these things in mind. I hope this is useful. Thank you.